and thought, you know, this looks unusual, you should get that checked out.
That's actually very common.
Is it
that
really?
happens a lot.
You know, we don't think of the places that you can't see or that are hidden from the sun exposure.
And to be perfectly honest, you know, your hairstylist is going to see your skin many more times during the year than any doctor will.
Yeah. Yeah.
And I mean, you know, that's not just dermatologists, but any doctor. And so, you know, hairstylists and barbers, they actually have to take kind of a little educational sort of training about that sort of thing.
It's great though. I mean, that, you know, her stylist found it. I thought to myself, wow, they need a big tip, you know?
Yeah,
I mean, that you just, gosh, to find something so scary like that. Whew. Okay, we're just about to come on. Oh.
7, 6, 5, 4, 3, 2.
Hi everyone, I'm Kristen Presall. Welcome to this edition of Medical Monday. We're glad you tuned in tonight. We're going to be talking about something that's very timely because it is summertime. A lot of people outside enjoying the beautiful weather. Not so much today, it's pretty hot out there. But if you're one of the folks who gets out every day and you don't wear something to protect your skin, you could be in trouble down the road. Let's face it, I'm a child of the 70s and 80s, and I will say, you know, my parents didn't necessarily put as much suntan lotion on us. We weren't as protected as I think parents nowadays protect their children. And it's a good thing because, you know, when we're exposed in our younger years, definitely in our middle-aged years and even older, we can find spots and, you know, something that might look like a freckle that's a little bit raised. You need to go to your dermatologist and find out, is this something more? That's what we're going to be talking about tonight, is we're going to be talking about skin cancer awareness and any type of way to prevent it. We, of course, have an expert on tonight. You're not going to just be talking to me, thank goodness, or I would tell you a lot about my childhood and the fact that I was not protected. But we have a guest, as I mentioned, Ronald Nelson, Dr. Ronald Nelson. He is associated with Middle Tennessee Medical Center. You can call him Junior, although I will call him Dr. Nelson because that is what he is, a dermatologist from the area. And we are glad to have you on today. Thanks so much for being here.
No, thank you.
We need to mention also that Dr. Nelson just opened up his new clinic, and that's Stones River Dermatology. Can you tell us where that is?
We're located at 1608 Williams Drive in Murfreesboro, and we just opened our new facility today in our new building.
Terrific.
So it's right near the campus of Middle Tennessee Medical Center.
Yeah, and you help a lot of people with situations of any kind, of course, you know, skin problems. But when we're talking specifically about skin cancer, there are several different kinds of skin cancer out there. The one that's, I think, most well known to a lot of the viewers out there is probably melanoma.
Yes, ma'am.
Because it is considered probably the dangerous kind.
That's correct. It's the most deadly type of skin cancer. It's responsible for about 75% of all deaths that occur from skin cancer are due to melanoma skin cancer.
Goodness.
It's the type that can spread all over the body and be very aggressive. And
has melanoma ever spread to organs? If it
Yes.
Okay.
Yes, ma'am. It has the potential to spread from the skin to other organs in the body, the brain, the heart, lungs. It can spread to many organs, and it can spread very rapidly if it's not caught early.
Sure. You know, I was just mentioning, obviously, in the very beginning of the show of, you know, how kids, even nowadays, wear more hats, you know, the rash guard shirts, which are great, you know, if you're going out to the pool, different things like that, just to protect your skin from any kind of damaging rays. But when would you say people should start getting their skin checked by a dermatologist? I mean, at what age? Teenage years or earlier?
Well, the American Academy of Dermatology recommends that anyone should, with risk factors, which means lots of moles, family history of skin cancer, personal history of skin cancer, should be examined at least once a year after the age of about 20. And I certainly would concur with that recommendation. It's never really too soon if you have something suspicious to come on in and get it checked out.
Sure.
So I wouldn't necessarily wait for a magic number of age 35 to be checked out if you've got a suspicious place.
Okay.
I personally, in my practice, have diagnosed melanoma in a young lady that was the age of 22. So it's not unusual for that sort of thing to happen now.
Okay.
And so if someone has a spot, they need to get it checked out regardless of what age.
Absolutely. Dr. Nelson, what causes melanoma?
It's caused by ultraviolet exposure, sun exposure.
Okay.
Is basically what causes it. As all skin cancers are caused by ultraviolet and sun exposure. There are some other risk factors as well, such as genetics, family history, and those type of genetic syndromes are fortunately very rare. They're not that common, but some people are genetically predisposed to the development of skin cancer and development of melanoma. And there are some other issues with that too. Other types of skin cancer can be caused by certain chemical exposures as well as sun exposure as well as ultraviolet exposure.
Yeah,
So
and I guess don't think for a minute that even if the place where you find some sort of skin cancer isn't exposed to the sun doesn't mean that you can't get it on maybe the back of your neck or
That's correct.
Along your waistline or something like that. And I know that seems so weird, but certain places that are even covered, you can still get
That's
some
correct.
sort of skin cancer.
That's absolutely correct, and that's something that, again, we don't fully understand all the reasons why people develop melanoma.
Sure.
But for the most part, the biggest risk factor is still, I should say, the biggest controllable risk factor, because we can't obviously change our genetics, but certainly the biggest controllable risk factor is ultraviolet exposure, sun exposure.
Okay.
And most of that sun exposure occurs, as you mentioned, when you're a child.
Yeah, small. What are some of the symptoms people should look for specifically regarding melanoma when you're doing any kind of scan? Maybe you're a mom looking at your child, or a wife looking at your husband. What are you looking for specifically?
Specifically, what you're looking for on a self-examination is the four criteria, the A, B, C, D criteria, and then also there's the E that a lot of people send in. But the A stands for asymmetry. And that means one half of the mole doesn't look like the other half. You cut the mole in half and they just don't look, one half doesn't look the same. That's potentially a problem.
Okay.
B would stand for border irregularity, whereas you may have a very, very smooth border, but then it's got an arm sticking out of it.
Oh, I
Okay.
see. Okay.
And then C stands for color variation. And that refers to a mole that may have several different colors. It may be red, black, brown, tan, even blue, or even white, all in the same mole.
Oh, wow.
Now you can have a brown homogeneous mole that may be one color brown. You may have another one that's tan. The two of them by themselves are okay, but if they're two of them, two colors together in the same mole, or three colors in the same mole, that's the concern with the color. And then D refers to diameter greater than 6 millimeters, which is about that of a pencil eraser or a pen cap.
Okay. So something more than that, you've got to really.
And then those are the things that you look for. And then obviously too, I always tell patients that I get to see kind of a snapshot of what goes on that day, and a mole may be totally normal to my exam, but if it's evolving, which is the E, if it's changing, if it's growing, if it's bleeding, that's something to be concerned about. And if that sort of thing is happening, that oftentimes trumps all those others. You may have a mole that looks totally fine, but if it's new and growing rapidly, that still deserves evaluation and biopsy.
Okay, now I was told this, and for all the ladies out there, you may have been told this too. I have a mole on the bottom of my foot, and I told my doctor, I said,
Yes, ma'am.
ever since I had my second child, it looks bigger. And I was told sometimes moles, when you're pregnant, do evolve.
That's
they
correct.
do change.
They do.
So should you still be nervous about something like that and get it checked out, or do you just say, well, that could be because I was pregnant?
That's correct, and that's still a difficult issue, not only for the person that's looking at that mole, wondering if it's a problem, but also for dermatologists and physicians too, because moles do oftentimes change during pregnancy. The criteria, however, I think for diagnosis should still be the same. If there's a suspicious mole, even if someone's pregnant, it's still a suspicious mole and
Sure.
needs to be evaluated and treated as a suspicious mole. The concern being that melanomas can also develop in pregnancy regardless of whether you're pregnant or not. You can still develop melanoma.
Interesting. Okay.
And so it is important to have those evaluated, and if they are changing, if they're growing, and then get them treated just like any other mole.
And how are these spots diagnosed?
Primarily it's by either a dermatologist or a primary care physician will evaluate the mole and do a biopsy. It's the moles and abnormal moles are still a diagnosis of melanoma is by looking at it under the microscope to get establish that pathology.
Sure.
And so that's something that at the present time there are some treatments that are invasively improving our ability to diagnose abnormal moles, but still the gold standard is to remove a portion of the mole and have that looked at under the microscope. That's still the gold standard approach.
Yeah. Okay, very good. We are talking again with Dr. Ronald Nelson, Jr. If you would like to call and ask him a question, he's a dermatologist down in Murfreesboro. Feel free to do that. You can call 737 plus is our number. We have open lines right now. We'd love to hear from you, so if you have a question, call in now. We'll be right back. That type of thing, and then prevention of them.
Okay.
Yeah, but I brought up the whole mole in my foot because when I was pregnant, my doctor said, okay, thank you. Spots and things like that, you wouldn't ever believe, but things like that really change.
They do.
Sometimes
they change.
when you're pregnant. I'm like, that's so interesting.
And that's and there's actually some research that was done at Vanderbilt showed that some moles, nevi, the cells, the melanocytes that make up those moles actually have estrogen receptors on them, and so the speculation that maybe the increased levels of estrogen because of pregnancy result in moles growing. I mean,
Sure.
Again, it's still not, the science is not totally worked out, but
Sure.
it's definitely observed.
Yeah. I also got a lot of broken capillaries, and my doctor said your blood flow increases so much when you're pregnant that happens a lot too for certain women. If your family has that too,
Yes.
which I was telling you, I'm like, that's my whole family.
Yeah, the broken and particularly on the legs too,
Yep.
and that's not only a kind of it's a mechanical because of the extra blood volume and
Sure.
The pressure of the
Sure. Yep.
pressure of the womb. That all contributes to the leg varicose veins and
Yeah.
leg. And the
Are
legs.
there ways to remove broken capillaries or no?
Yes.
Is
yes,
it
there's
laser?
a laser.
Yeah.
Laser is or sclerotherapy on the
Oh.
lower legs, which is an injection of a particular solution to destroy the capillaries, the broken
Wow.
blood vessels.
Is that injected with a needle then?
Yes, ma'am.
Wow. Is it painful?
Actually, there are several different solutions, and some of them are a little bit more painful, and they still involve, injection of a needle. So
Sure.
there's that kind of.
Yeah. I don't really have issues with needles, but I know a lot of people who do. That's why I'm like, ooh, wow.
Yes. Try to use a real small, the teeniest needle that you can possibly use. But,
Yeah. Can I request the smallest one you could possibly find in the medical practice?
Right. Absolutely.
Yeah.
Try to do that.
Well, good. Well, we do have some calls coming in, and
Okay.
so I'll kind of weave these calls in with what we're
Sure.
talking about too.
Sure.
They may be off topic, but that's okay.
That's
but
okay.
Like I said, we'll eventually get to other things that we can discuss too. But I imagine you tell people to do self-examinations
Yes.
and then
once a
come in
month
to
and-
have an exam as well. Okay, we've got about 30 seconds before we come back on,
Okay.
because we'll talk about treatments too. All right. Okay, we're just about to come back on. Welcome back, everybody, to Medical Monday. We will be taking a couple of your phone calls here in just a moment, but if you've not called in, 737 plus is the number to talk with Dr. Ronald Nelson tonight, dermatologist here from the Mid-State area. And we're talking about skin cancer, the awareness of it, and any kind of prevention information and advice that Dr. Nelson can pass along to you as well tonight. So very important information. Pass it along to friends and family, any loved ones that you have. Before the commercial break, we were talking about melanoma and also how it was diagnosed, how it is diagnosed. We want to talk about treatment real quick before we take a phone call, because I think a lot of people just assume when you have cancer of any kind, you're going to automatically have some sort of chemotherapy. That always seems like it just kind of goes hand in hand. What is the basic treatment for melanoma?
The basic treatments for melanoma are largely divided based upon the amount of invasion of that melanoma, the depth of invasion of that melanoma, the depth of the abnormal skin cells in the skin. And If a melanoma is very thin, meaning it has not started to invade, it has not started to spread anywhere, then excision of the melanoma is all that's necessary. You know, cut the spot out
great,
and sew it
yeah.
back together with stitches, and that is generally curative in a great majority of patients. The survival rate for melanoma, meaning that, you know, take everybody that has a melanoma of a certain stage and place them all in a group 5 years later, you know, 98, 99% are still going to be alive at the end of that 5 years, not have died from their melanoma if it's caught very, very early. Now, if it has invaded into the tissues below the skin, if it's spread to the lymph nodes or to somewhere else on the body, you know, that survival rate, instead of being, you know, in the 98%, 99% kind of, it goes down to, you know, 5 to 15%. It can be a lot more aggressive at that point.
Sure.
And this is where you read the most about the chemotherapy agents that are being studied and treatments like that, is in those advanced treatments of melanoma.
Sure.
Most of the melanomas, fortunately, most of the melanomas that are diagnosed are either in the very, very early stage, the melanoma in situ stage, or just in the very earliest stage of invasion. And those have a much, much better prognosis, where oftentimes, you know, there is no chemotherapy or interferon treatments are necessary.
And then I imagine you still have to get checked up
That's
by
correct.
your doctor.
That's correct. And
every
have
now and then, yeah.
routine surveillance for melanoma thereafter.
Okay.
And so that's something that, once someone has had melanoma, tend to be very aggressive about, you know, keeping their follow-ups and making sure that they come back, because someone who's had melanoma once is at increased risk for getting melanoma
More
again.
susceptible, yeah. Okay. Let's go to our phone lines, if you don't mind, Dr. Nelson, and we
Yes,
will
ma'am.
talk with a couple viewers out there. I think Teresa's been holding on the line the longest, so let's talk with her first. Hi, Teresa.
Hi, how you doing?
Doing well. What's on your mind tonight,
Yeah,
ma'am?
you did answer one question I had, but I had another one.
Okay.
If there's other type, if you have a family history of other types of cancer, could you also get skin cancer?
So say if you had like pancreatic cancer or lung cancer, can you also get skin cancer
Yeah.
down the road?
Yes, absolutely. There are some connections genetically between pancreatic cancer and melanoma, for example, and there have been studies that do show an increased incidence of things like breast cancer with basal cell carcinoma, some of those types of skin cancers. So yes, that can happen.
Okay.
All right, Teresa, do you have this in your family or just
Breast cancer.
breast cancer? Yeah.
Uh,
So it's just something that you do. You protect yourself when you're out in the sun?
yes, I do. I don't stay out very long.
Excellent.
I
Good.
make sure I drink plenty of water too.
Good. Well, you're on the right track. That's what you're supposed to be doing.
Okay.
We appreciate you calling in, Teresa.
Thank you.
Thanks a lot.
Bye-bye.
All right, our next caller is Patricia. We'll hear from her. Hi, Patricia.
Hello.
What is your question for Dr. Nelson tonight?
My question is, well, I've got two actually. I was taught in nursing school that if you had a hair in a mole, that this is a good indication that it was not malignant. My second question is basal cell carcinoma and the malignancy that we've been talking about, the more aggressive, that's two different types of cancer. But would, if one runs in the family like the basal cell carcinoma, would it be closely related to having the other type of cancer? Plus, now, my third question is, a lot of these people are burning these cancers off, and I was taught in nursing school, when you burn, you're introducing those carcinoma cells into the bloodstream, whereas if you cut it off, but then I have a sister that's had her nose whacked and whacked and whacked and whacked, and they keep saying, well, we'll see if margins are clear, you know.
Oh.
And these are local towns, not Davidson County.
Okay, and so you have a sister who's had skin cancer or something like a basal cell?
Well, my brother and my two sisters.
Okay. Okay, well, hold on the line, Patricia. Hold on the line, please.
Well, to answer your first question, Teresa, if you have a mole that has hair on it, that oftentimes can be a very reassuring sign that it is not malignant. but it doesn't necessarily guarantee that it's not malignant or potentially could turn into a skin cancer. So it's important to evaluate that mole based upon the criteria that we discussed earlier, the A, B, C, D, and E criteria. If a mole is changing, for example, or the colors are suspicious, even if a mole has hair in it, that's something I'm still going to recommend biopsy and to evaluate under the microscope. Now the second question was regards to basal cell skin cancer and melanoma skin cancer. Although both basal cell skin cancer and melanoma skin cancer are both skin cancers, they are very different and they behave very differently. Melanoma skin cancer, as we just discussed, is the more aggressive of the two, and that's the one that if it is not caught and detected early, can potentially spread all over the body and threaten your life, and represents the most common cause of skin cancer death. Now, basal cell skin cancer, on the other hand, there is an extremely common skin cancer to the such that in the United States, about 1 in 5 people actually will be diagnosed with basal cell at some point in their life. Basal cell skin cancers, 80% of them tend to occur on the face and the neck. And so because of the location where the basal cell carcinomas arise, because they can be locally invasive, they can end up eating away somebody's nose or destroying someone's ear, for example, if it's undetected and untreated. And so consequently, to bring up the third question, which was about treatment of basal cell skin cancers. If they're caught early and they're small and maybe on the back or the chest or on the arm, in a lower risk area like this, they can be successfully treated by a dermatologist or another physician using a technique called electrodesiccation and curettage, where it would be anesthetized in clinic and then scraped and essentially use a device to stop the bleeding. And many people refer to this as kind of scraping and burning a skin cancer. And that can be a very successful treatment for a selected small basal cell carcinoma. On the other hand, if it's on the face, for example, in a more sensitive area where that particular treatment would lead to a larger scar, then surgical techniques where you actually cut out the lesion, make certain that we get clear margins and completely remove the tumor is indicated for that.
Yeah.
And so there are several different treatment options for basal cell carcinoma, and it's important that if you were diagnosed with a basal cell carcinoma, to discuss that with your physician and get the opinion of someone who treats skin cancers on a regular basis.
All right. Well, Patricia, I sure hope that helped you out.
Yeah, but what I'm concerned is that burning of those basal cell carcinomas, that's not a good practice for the face, is it? Because when need to cut into it, right, and excise it instead of burning it, correct?
Well, again, it depends specifically on the area that's being treated, particularly on the face. Some of these areas which tend to be higher risk for recurrence, higher risk for spread, and to damage some of the crucial areas on the face, around the eye or on the nose, around the lip. Again, these are areas that doing the burning treatment can lead to higher recurrence rate and can lead to more problems. That's correct.
Yeah.
But a lot of that, you should discuss with the physician that's treating you and taking care of you about the specifics of that treatment.
All right. Well, Patricia, thank you for calling in tonight, ma'am.
I appreciate it. Thank
All right.
you.
Thank you, ma'am.
Take care. That was very impressive that you remembered all her questions, because I think I remember 2 out of the 3, but that's great, Patricia, that you asked so many, and we just want folks to be encouraged, and we want people to really get a good grip on this. And so if you have any kind of questions like Patricia has, call in and ask them now, because we have an expert here in the field who can answer anything that you might have. So throw those questions at them. We're going to talk with Shirley real quick, and then we'll continue on with our conversation as well. Hi, Shirley.
Hi.
Thanks for calling in, ma'am. What's your question for Dr. Nelson?
Dr. Nelson, I have several moles that came up on my temple that's sort of like patches and real rough. And then on my right arm, I have several moles that looks like they're white, and you can rub them, and it'll, like scabies, the flakes will fall off, and then it tends to bleed pretty heavy.
Okay.
Yes, ma'am.
Yep.
Well, these are the kind of spots that I would recommend that you have evaluated by your physician or your dermatologist, because potentially if the rough spots on your arms, if you are scratching those off and they're bleeding, those are the type of spots that could potentially represent skin cancers or precancers. Skin precancers, we call those actinic keratoses, and those will often appear white and crusty and very hard on the surface of the skin. And they represent a precancerous type condition. They have not taken the next step to being a skin cancer to where that they're invading under the surface of the skin, but they could potentially progress to that, and so therefore they do need treatment still. So I would seek the advice of your physician or your dermatologist to get that evaluated.
Okay. Shirley, thank you for calling in tonight.
Well, thank you so much, and I just want to tell Dr. Nelson thank you. He took a piece off of my granddaughter, Amber Holmes's face, and it came back negative. So I want to thank you so much, and thank you for talking to me.
All right. Very
Thank you,
good.
ma'am.
You have a good night, Shirley.
You too.
Okay. Well, we are going to return, but if you have a question, again, 737 plus is our number. We'll be right back, everybody, after this. And we have people who call in when they recognize a certain doctor, and they'll call in. And sometimes a lot of it is just, patients that they've themselves have treated, and it's always good. I mean, Gail's screening in the back, so she's not going to let anything slide that's not good. Let's hope this is positive.
Let's hope it's positive. And
No,
I hope
it's
that's
always
not
good.
I guess since the patient brought it up, it's okay, because she.
Well, the one lady who, Patricia, who went to nursing school,
Mm-hmm.
she had some good questions, but
She did.
I mean, obviously she didn't hear the first time when you were trying to explain the whole burning and cutting thing, but
Yeah, but that's and that's true. The burning and things like that does have a higher recurrence rate in certain areas of the body, and so I tend not to do it much.
yeah.
It also tends to, I think, sometimes can leave kind of nasty looking scars.
Oh, well, I was going to say I've had several spots removed and nothing has ever been burned. Cut, yes.
Yeah.
They take the big needle in,
Right.
numb it, cut. I'm like, ugh. But
And there are some topical treatments now too, which for people that just don't want scars or surgery, and now it's not as effective as cutting the skin cancers out. It's not as effective.
Yeah.
But for somebody that doesn't
It's just so fearful.
doesn't want to have it cut out, or has a spot in a kind of a sensitive area where they can't tolerate a scar, and they're willing to. It takes longer because cream doesn't work as fast. So, but hey, that's all right. Some people, everybody has their own risk tolerance.
Yeah,
of where they fit.
Your pain threshold.
Yes, that's right.
And not everyone has a high one, that's for sure. Okay, we're just about to come back on. Welcome back to Medical Monday, everybody. Phone number here, 737-PLUS, and you can call in right now, talk to Dr. Ronald Nelson. He's a dermatologist affiliated with Middle Tennessee Medical Center, works over at the Stones River Dermatology Center. It's brand new. They just opened it today, so you can go and see him. We'll give out a phone number in terms of how you can get a hold of Dr. Nelson at the end of this program. But we've been talking about skin cancer and taking several viewer phone calls. Thanks for calling in, and for those of you who haven't, please do. Just talking basically about melanoma, our conversation, and what to look for, how it's diagnosed, how it's treated. And we'd want to talk, one of our callers touched on another type of skin cancer. There are several different types. And it was Patricia who pointed out, talking about basal cell. So we also, we know melanoma exists, but we also know that there's, as you mentioned, basal cell and squamous cell. Am I saying
That's
that
correct.
correctly?
Squamous cell.
Those tend to, like you said, happen on parts of your body to where they're smaller maybe, and they're not as serious as maybe a melanoma.
That's correct. Now, the difference really between basal cell and squamous cell is in the level of aggressiveness.
Okay.
basal cells tend to be more locally aggressive, and they tend to occur primarily on the head and neck and the face. These areas are sensitive because if a skin cancer invades locally into your nose and eats away your nose, that's a very significant problem.
Sure.
But it's not the type that's going to spread all over your body and go into the lung or the brain and represent a threat to your life, typically. Now, squamous cell, on the other hand, can be locally aggressive, as well as it can potentially spread, particularly if you get a larger size to the squamous cell carcinoma. They can potentially spread to the lymph nodes and can represent a threat to someone's life if they spread beyond that. And that does happen.
And squamous cell, where would you find that on your body?
These, again, can occur on the head and neck.
Oh, okay.
They also are very, very common on the arms and in sun-exposed, chronically sun-exposed areas of the skin is where they're most common. See them on the hands and the arms very frequently as well.
At what age should you stop getting moles? I mean, we see them, you know, throughout our lives, and all of a sudden notice, oh, hey, I've got a new mark. My little ones like to say they're boo-boos, but
Right.
you know, because they don't understand it just yet. But I mean, in terms of when should someone stop, you know, having moles appear on their skin?
Well, in general, we get most of our nevi or moles, as most people call them, between the teenage years and up to about the age of 35 or 40.
Okay.
And that's kind of the time period when you will have most of your moles arise, is in those early years of life. So if you develop a new mole and you're 65, that's probably something that needs to be evaluated.
Sure. Yeah.
And again, that doesn't necessarily mean that you have skin cancer if you have a new mole, a new nevus, I should say. But it means that it's probably something that you should think about having evaluated.
And not just, I shouldn't just say moles, but any kind of raised bump or any type of
That's correct.
spot that looks discolored and unusual on your
That's
skin,
correct.
what you had talked about earlier. Okay, so basically, as we know, there are several types of cancers that you need to, you know, get checked out. If you notice something on your skin, definitely go to your dermatologist right away or your prime care physician. They can refer you to someone if not.
Absolutely.
But let's talk about preventing this kind of thing from happening to you. I know that you'd mentioned if this is something in your family history, you might be more susceptible to it
That's
than
correct.
someone else.
Yes, ma'am.
At least being, you know, getting the freckles and the moles and the, you know, unusual, like I said, the spots, the raised bumps, that kind of thing. If your father or mother has this and you have their kind of skin type, chances are you're going to get this too. If they have melanoma, you may not get melanoma, but you're more, again, susceptible to something like that.
Your risk is higher than that of somebody in the general population.
Sure. We talked about covering yourself in certain ways,
Yes.
and more ways than one, just in terms of using sunblock, but then also having some sort of protection on you, clothing, light,
That's correct.
white, you know,
That's correct.
clothing. What else can people do to prevent getting skin cancer?
Well, the most important thing are to, you know, limit the amount of ultraviolet exposure that you have. And the limits that you can control yourself are to stay out of the peak hours when the sun is brightest with the most ultraviolet. And that's generally between the hours of 10 o'clock in the morning and 4 o'clock in the afternoon.
Okay.
That's the peak time for ultraviolet exposure. So if you garden, for example, the best time to do it is early in the morning. You're not going to sweat as much on a day like today.
Yeah.
It's going to be a lot more pleasant. You'll probably get more done, and you'll be out of the sun by 10 o'clock in the morning so that you can rest during the heat of the day, and maybe again go back out in the evening if you needed to work in the yard and finish your weeding. But these are the kind of things that you can do to try to change some of your behaviors to avoid that. Wearing wide-brimmed hats, wearing sun protective clothing, long sleeve shirts, gloves, long pants. These are also some of the things that you can do to protect your skin from the sun. Also wearing sunscreens, and particularly if you're going to be outdoors doing sports, you need to wear a sunscreen that is water resistant and is going to stand up to perspiration or to swimming or water skiing or
Oh, yeah.
whatever you like to do.
All those activities, yep.
I actually recommend to change sunscreens like you change clothes. And by that I mean you don't go swimming in a suit or what you're wearing today.
Apply it several times.
So
Yeah.
you need to wear a different sunscreen today than you would if I was going to go out and work in the yard. I'd wear a different sunscreen, something that's got a higher SPF, that's going to be water resistant.
Yep.
And the same thing goes with people who golf or ride horseback or hike or
Tennis, all those outdoor things, yeah.
whatever outdoor activities that people do. And believe me, I encourage people to get outdoors and enjoy themselves and just protect their skin from the ultraviolet exposure.
Yeah.
Block the sun, but not the fun.
Yeah, and you need the nutrients of the vitamin D and that kind of thing, but like you said, limiting your time out is crucial.
Correct,
Yeah.
absolutely.
All right, if you don't mind, let's go back to the phone lines. We'll
Yes,
talk
ma'am.
with some other folks, and we have Madeline on the line. Hi, Madeline.
Hello.
Thanks for holding, ma'am. What's on your mind tonight?
Well, the one thing I haven't heard us talk about is the dreaded tanning bed, and just wanted to get his thoughts on that. And I just see all these tanning bed places opening up. What are people really putting themselves at risk of using the tanning bed?
Okay,
And
good
I'm going to
question.
hang up and listen.
Okay,
Okay.
good question. Thanks, Madeline.
Well, you bring up a very, very important question about the tanning beds. Tanning beds are about 28 million users of tanning beds in the United States now. And the heaviest users of tanning beds are actually young women. About 70% of tanning bed users are young women for the ages of 15 and 29 or 30. And this is also a group that has seen an increase in the rate of melanoma skin cancer in recent years. And so the increase in ultraviolet exposure is something that can occur with the tanning beds that can potentially induce skin cancers, and particularly melanoma skin cancers. So tanning beds are something that I certainly do not recommend in the course of my medical practice. I will say, however, that occasionally I do have some patients who have medical conditions that we treat with phototherapy, and that's make a specific recommendation to use the tanning bed for, say, psoriasis, for example. The vast majority of people using the tanning beds are not in that case. They're doing it recreationally to develop a tan,
Yes.
and not to treat a medical condition. So again, it's not something that I typically recommend in the course of my medical practice, and I've seen many people who were excessive tanning bed users who have ended up with skin cancers at a very young age.
And they were so popular for so long, and they still are to
And they
some
still
extent,
are.
but thank goodness there's like a spray tan now that people do that
Yes.
doesn't seem as though, it's...
And I do recommend, if somebody wants to have the appearance of a tan, to get the spray tan,
Yeah.
which again, I think are very safe,
Yeah.
provided that they're used properly.
Yes, and don't even overdo that, too, I'm sure. Okay, I'm going to ask our director, Andrew. I know that there is someone else holding. Andrew, can you tell me the person's name, if you don't mind? Okay, all right. We're going to go ahead now and visit with Kathleen, and I'm so sorry, Kathleen, I didn't hear your name earlier, but thanks so much for calling in. What's on your mind tonight?
Well, I have three quick things, and I didn't catch the beginning of the program, so you may have addressed this one already.
Okay.
Do all skin cancers start out with moles?
The answer to that is no. Not all skin cancers will start out as a mole. Many skin cancers arise just on previously normal skin, and this can occur very commonly with the development of basal cell skin cancers, or even melanoma can arise in previously normal skin. It does not necessarily have to start with a mole.
Okay, very good.
Okay.
All right. What are your other questions, Kathleen?
Okay, the other two, real quick. I have a lot of brown, splotchy discoloration on my skin, mainly on my arms and my face. And I also get little white spots that just look like somebody took a paintbrush and dabbed me with some white paint.
Mm-hmm.
Okay.
Yes, ma'am.
Then I have a few, they look like, they're shaped like a mole, but they're red. like they're blood filled, and I didn't know what those were.
Okay. Well, the most important thing, of course, for you would be to seek the opinion of your physician or your dermatologist for these spots. But oftentimes those red moles that you have that are filled with blood, we oftentimes find those on the chest or the belly or the back, sometimes the legs. These are typically what we call cherry angioma, and they're little collections of blood vessels under the surface of the skin. And these are most associated with wisdom and experience in life. Okay? So it's one of those things that you can oftentimes develop those on the surface of the skin, and they're typically totally benign. Now, that's of course something that she does need to go and see her doctor about,
Sure,
since I
check 'em
can't
out.
really check it out over through the camera here today. As far as the brown splotches and the little white spots that you spoke of on the arms, oftentimes these can be the result of sun damage on the surface of the skin. But again, that's also something that you'll need to have evaluated by your physician or your dermatologist to make sure that it's not a skin cancer potentially developing in that site, or a precancerous condition like what we call an actinic keratosis.
Yeah. So Kathleen, I hope you got all that information.
I did. Thank you very much.
Thank you for calling in. Yeah, I think as a lot of women and men age, you will tend to see some different discoloration, as you mentioned, on your arms and legs. But you still have to go and get things checked out.
That's correct.
No matter if you know that this comes with age, it still doesn't hurt to go and make sure everything's okay. So
now
definitely
Kristen, I've actually banned the use of the three-letter A word in the clinic, so you'll have to say wisdom and experience.
I see.
From
All
here
right.
on,
Well,
so.
my daughter was actually born with a cherry angioma, so I don't necessarily. Born with it. I was like, I don't know about wisdom just that, but
Right,
she'll get
exactly.
there. All right. Well, we are talking again with Dr. Ronald Nelson. There's still time to call if you have questions. 737+. We will be right back. We'll join you after the commercial break, okay? We had to take a quick break, and we'll join you right afterwards.
Okay.
Thank you for holding, ma'am. Yeah, she was born with an angioma right there, and it looked huge. And I was like, "What is that?" And they said, "Oh, that'll go away after a while." And it's I guess maybe gone down a little bit, but not a lot.
How old is she?
She's now she turns 2 in August.
2.
Yeah. So I would have thought this would have shriveled up by now, but I guess it takes some time.
It takes usually till about age 5 or 6 usually.
Okay.
My daughter had one on her eye.
Oh, really?
Right above
I've
the
heard
here.
people get them on
Yeah,
their
she had
eyelids.
one
Yeah.
right above the eyelid.
How big was it?
Well, it got to the point where it was, holding her eye shut.
Wow. So
And
she had to get it removed.
Well, yes, they had
Yeah.
to. She was at age 2 months.
Oh,
She was
bless her heart.
put to sleep, and they gave her the general anesthesia, or sedated her in such a way so that they could inject into this area.
So how did they remove it?
It's actually injected by a steroid medicine.
Interesting.
Injected by medicine, and there are some other medicines now for infantile hemangioma
That will shrink it.
That'll shrink them down. Yes, but that's something that has come out in the research field since she was born, and so probably today they'd give her the medicine as opposed to injecting it and subjecting her to general
Gosh, that's so
anesthetic.
interesting.
But it preserved her eyesight, because the eyes, if they don't develop movement properly, can end up with
Yeah,
lazy eye and
sure.
things like that. So they have to. There's a crucial period of time when the eyes develop, and if one eye is shut, then they don't develop that ability to see together.
Sure. Well, I've heard that angiomas, if big enough, can pose some problems
Yes,
in children.
they can, but particularly around the eye
Face,
or around
yep.
the mouth. It
Yep.
can distort the ability to chew or to
speak.
cut off the nasal passage. I mean, there's a
Oh,
number of different
goodness.
things. Here I am doing all this kind of crazy stuff.
No,
Hope I'm not on camera.
No, you're not. Wow. Well, I'm glad your daughter's okay.
Oh yeah, she's doing fine now.
And at
She's,
2 months. Did she ever know that she even had any kind of issue?
No.
Yeah. You can't
Well,
tell, I'm sure, either.
you can still see where the skin is a little bit discolored there, but I think
interesting.
it's when she's old enough to start wearing mascara and things like that, it's just not going to be any big deal.
Won't matter.
It won't matter. And
Really
you can only really see it if you're really,
Right up
looking
on her,
right up on her, looking
Yep.
closely.
Wow. All right, we've got about 15 seconds. We'll come back up. And all I have is Carol on there, right? I guess that's it for. Welcome back to Medical Mondays, everybody. We are talking with Dr. Ronald Nelson, dermatologist from Middle Tennessee Medical Center in the area, Stones River Dermatology actually down there. So we'll be giving out a phone number in terms of how to get a hold of him by the end of the program. And again, if you have a question, there's still time to call. 737+ is the number. We're going to go back to the phone lines and talk with Carol, who has been patiently holding. Hi, Carol.
Hi.
Thanks for holding, ma'am. What's on your mind?
I just wanted to let everybody know that Dr. Nelson is awesome. I have been fighting psoriasis for 20 years.
Oh.
And this is the first in the last almost year and a half that I have been completely cleared. I've been to dermatologist after dermatologist, went through clinics and everything, and he has just been awesome.
Well, excellent. We're so
appreciate
glad you
saying
called
so.
in.
Hi, Dr. Nelson.
Hello.
Yeah,
That's
he's
great.
just an awesome doctor, so I recommend him highly to anybody. I've
That's
got
great.
one of my sisters in with him, and then I've got another one wanting to come and see him too. So.
Well, good. Keep it coming. Well, Carol, thanks a lot for calling in and sharing such nice comments.
Okay,
We
thank
sure
you.
Thank you,
appreciate
ma'am.
it. All right.
gracious.
That's nice to call in. You always want to hear that kind of stuff. And obviously, I don't think that we've had a doctor on here that hasn't been, praised, and they definitely deserve it. So, well said to
appreciate that.
Carol.
That's great.
Anyhow, we'll continue talking about what we were talking about too, Carol, which is, of course, skin cancer awareness and prevention. We've had some great calls all night long from a lot of viewers out there. And I think that, and please correct me if I'm wrong, Dr. Nelson, but it seems as though treatment and prevention has come so far. I mean, I always heard back in the day and in the 40s and 50s, people were outside and working in fields so much that,
Yes, ma'am.
their exposure to the sun, albeit maybe not as intense as it is nowadays, but they didn't necessarily protect themselves. They did wear the long, probably, shirts and that kind of thing, but more or less you probably see it maybe in some seniors or baby boomers along their forehead and,
That's
on their
correct.
head.
That's correct.
I know my best friend's father has been through melanoma several times, and because he was outside, and it was right along his hairline and that type of thing. But nowadays it seems like there's so much to protect us in what we're doing. Like I said, the
That's
rash
correct.
guard for kids, that's terrific. If you don't have those for your children, get them because they're great. Also, you even see, makeup companies putting it in makeup, SPF.
That's correct.
And that type of thing. Have we made progress, do you think, enough to where people are finally getting it, or does the word still need to get out there?
I think that people are getting the message now about protecting their skin from the sun, and it's something that I see fewer people that are out, with the baby oil and the iodine and things like that now than what may have gone on in the past. Certainly from what I remember from when I was a child, but I still think that we have a long way to go too, because there still is a perception that a tan is healthy, and there's really no healthy tan. There's really no healthy tan, because a tan essentially implies that you've had enough ultraviolet exposure to darken the skin that's enough to actually have damaged the skin that could potentially lead to increased risk of skin cancer down the road. One thing that's concerning though is, as you mentioned, people that had exposure 40 and 50 years ago, all of us nowadays are living longer. Our life expectancy is greater, and I think that contributes a lot to the increase in the amount of skin cancer that we see in people who are in their 70s, because they had that exposure 50 years ago, and the delay time is, if you will, finally caught up with them, and now they're developing their skin cancers, and it's very, very common in seniors to have these type of malignancies.
Absolutely. All right. We're going to go back to the phone lines right now, and we'll talk with Tim. He just called in. Hear what he has to say. Hi, Tim.
Thank you, ma'am.
Yes.
My call.
Sure. What can we do for you tonight?
I wanted to ask the doctor about, I had a brother-in-law, he didn't have no spots or nothing on his skin, but he had a pain in his eye, and he went to see the eye doctor, and the eye doctor sent to see him another doctor, and he passed away 7 years ago with melanoma. And I just want to know if you don't have those spots, do you still have melanoma?
All right, good question. Hold on the line if you don't mind, Tim.
That's a very, very good question, Tim. It is possible to get melanomas in the eye. They're called ocular melanomas. And so you can develop melanoma even if you don't have a spot on the skin. It's also possible to have melanomas that are under the fingernail, for example, or under the toenail as well is another potential place for a melanoma to come up. And these are not the typical places that you would see a melanoma, skin cancer, or an ocular melanoma, but yes, it does happen. Another potential thing that can happen, and this is where sometimes melanomas get tricky, is that sometimes they're not brown or black. And that would be what's considered an amelanotic melanoma, meaning it doesn't have pigment. And those can be very tricky because they will oftentimes look a little pink spot on the surface of the skin. They'll look like a basal cell skin cancer, for example. So that's why it's important that if you are evaluated by your physician or your dermatologist, that your dermatologist does biopsy these spots and have them looked at under the microscope to fully identify what it is before proceeding with treatment.
Sure. Tim, thank you so much for your call, sir.
All right, thank you, ma'am.
We appreciate it.
Thanks, sir.
That is something that we haven't talked about. I mean, a lot of people just, go to do some sort of self-check or have somebody else look on your back and places that you can't see on the back of your neck. But sometimes you're not necessarily looking for obvious signs and symptoms. And that is something also that we need to discuss, is not just looking during the summer months and when it's hot out and that's the reminder of, oh, I've got to do a self-examination. I know dermatologists usually say, this is a year-round type of thing.
That's correct.
And in the wintertime, we're always reminded, hey, now's a good time to maybe check in with your dermatologist to see how your skin looks from head to toe. If somebody comes into your office and would like for you to examine them in that way, just to make sure that they don't have any unusual spots or marks on their skin, is it a head-to-toe type of thing, or are they to know about certain places that they want you to check out?
Again, I usually offer patients, a head-to-toe skin check. Some patients, though, only want, maybe the waist up or something like that. But generally, the most thorough exam is going to be a head-to-toe check, simply because there are areas of the body that you can't see yourself.
Sure.
I've met very few people that can spin their head around, like in The Exorcist, and look at their own back.
Thank
so,
goodness.
and which is a good thing, yes. But that's an area that you do need to have evaluated, because you can potentially find things there that you can't see yourself. And as we were discussing earlier before the show, sometimes there are people who, your hairdresser, that may find something that before any doctor does, for example, because your hairdresser certainly is going to see your hair a lot more times than your doctor if you only go to your doctor once a year.
That's right, yeah. So, but it's important regardless to take yourself, maybe your loved one or your family members, just to get checked out. And I know you had mentioned at the beginning of the program, when would be a good time to start doing that?
That's correct. And again,
yeah,
about once a year, and in general started about age 20 is where the American Academy of Dermatology recommends.
Okay, age 20. And again, keep in mind, everybody, for those of you who want to know, how to prevent something like this from happening to you, Dr. Nelson had mentioned earlier the different types of things that you should do, and definitely not going out during, peak time during the day when the rays are the most harmful and
That's
dangerous. And also, again, just make sure you have that sunblock on, even during the winter months. I mean, when you're outside and the kids are playing in the snow and that type of thing, usually they're covered, but it doesn't hurt to have some sort of protection on your skin regardless, whatever type of skin is exposed.
That's actually a very, very good point, particularly people who may go skiing or be involved in a lot of winter sports. The snow will reflect about 80% of the sun's rays.
Yep.
And so even though the sun is not necessarily as strong as it is in the middle of summer, that reflection of the 80% and the fact that you may not necessarily be as aware of wearing sunscreen, you can end up getting burned.
Absolutely. All right. We've been talking about skin cancer awareness and prevention. We're going to wrap things up. Grab a pen and paper, everyone. I'll give out a phone number in just a moment. People can call in to try to get more information, and maybe
Okay.
your phone number for your office.
Okay.
It won't be something that's directly linked to you,
Okay.
to where you're going to be funneling all sorts of crazy calls then.
Okay.
Because I'm sure
Well,
your phone lines are tied up enough.
No, that's all right.
Okay, you know what, Andrew,
We
I'm
just
sorry.
started my practice.
I know, well,
About
hey.
6 months ago. Some phone calls are
Okay,
good.
thank you. I am sure you would not turn them away, would you?
No, ma'am.
All right. So here's my list. And we are going to do this graphic on the way back, is that right? The rhythm of the heart? And do we want to announce both the understanding sudden cardiac arrest and the new approaches in atrial fibrillation? Okay. Oh, just RSVP. Great. Yep. Oh, if you would like to give your office phone number, you can do so. Or if you would rather me do it, I have your card right here, and I can do that.
It's the 904-2010.
Okay.
904.
It's a pretty easy number to remember.
Yeah.
I'll give that out to everybody,
Yeah.
if that's all right. If you
That's
don't mind us
perfect.
giving out.
That's perfect.
Okay.
In Stones River Dermatology.
Excellent.
And
Now,
again,
is this just your practice, or do you have some
Yes.
other partners? Oh, great.
yes. Got started in October, so we're still kind of
Now,
new.
what happens when you go on vacation? Who's covering? Do you have a nurse practitioner, or?
I haven't been on vacation yet.
Oh,
I'll let you know when that happens.
No, you've got to get on vacation. Is your office at least closed once a week, or no? Are you
I'm
Monday through Friday?
5 days a week. Monday through Friday, 5 days a week.
Oh
Hey, I'm
Alright,
starting.
you're
I'm starting out, and you're gonna, you know.
I know. You're going to eventually need some relief, I have a feeling.
Well, yeah, but that's I've got bills to pay, staff
I know,
to pay
I'm
first.
telling
You
you.
know
I
how that works.
I know, believe me. Okay. Okay, thanks, Andrew. All right, we're just about to come back. Okay, everybody, you are looking at an upcoming event for Baptist Hospital, St. Thomas Heart Hospital as well. The Rhythm of the Heart, two separate seminars taking place coming up July 19th and July 26th. For more information to RSVP to either one of these seminars, you can call 615-284-LIFE. Again, 284-LIFE. And by the way, that number will also give you more information about tonight's program, talking about skin cancer and also prevention. If you'd like to get a hold of Dr. Ronald Nelson, you can call him directly at the Stones River Dermatology Center, and that is 615-904-2010. Again, 904-2010. We appreciate you tuning in tonight. Thank you so much for coming in, sir. We appreciate it. You did a great job. And if you'd like to know what's going on next Medical Monday, just go to newschannel5.com and look under the Medical Monday section. Have a great night. Thanks a lot for tuning in. Calls, and they all come at once. And then all of a sudden you don't have calls for a while, and you're like, oh, okay. But these people kind of trickled in, so
Yeah,
it was
no, that
nice
was
because they
great.
filled up the hour.
I was kind of surprised it seemed like we didn't take as many calls as I expected, but
You know what?
it seemed like we talked.
I
They
know.
all talked. We all had a
continued
lot
to
of
have
stuff.
good
Yeah.
conversation.
Yeah.
Don't want that to happen. Okay, so if you don't mind, all you have to do is unclick that little mic.
Okay.
Put it back down your suit, Dr. Nelson, and we'll pull it out the bottom.
Okay.
Thank you. Thank you.
Thank you.
And I'll escort you out here, and Gail will whisk you away. Thanks, Ariel.
No problem. See you guys later. It was nice meeting you.
Thank you.
Okay.
Hey, how are you? Good to see you. Hey, Clay Travis. Good to see you. Hey, Clay Travis. Nice to see you. How you doing?
Okay, I'm gonna put you in the middle right here.
Okay.
Okay.
Damn glad to meet you.
And you can go right here. If you'll just snake this up to your shirt for me.
I thought we could do a video too. We could get Feinbaum or somebody to record something for us.
That could be really funny too. Yeah, he definitely do it. We're talking about the roast.
Oh yeah?
Yeah, we sold it out. So
For who?
For me.
Oh yeah?
Thought he's having a roast.
They wanted to do a roast.
Okay.
Thanks.
So
Nice.
I thought it was an okay idea, but I'm just shocked by how quickly like everybody responded and is set to roll.
You guys own the market, man. There's,
Yeah, I guess for the moment.
Mm-hmm.
See what happens.
Are they bringing competition, and you think?
Well, we're getting bought.
Yeah.
So I'm not sure what really honestly what George Plaster's going to do. Nobody really knows.
So that would be.
Well, he's done it before. He left to
Yeah.
to start a new site. So I mean, yeah.
Can you give me a mic check? Just count one to 10
Yeah.
for me.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, and then Jonathan.
1, 2, 3, 4,
That
5,
can be-
6,
that can
7,
be
8,
good for you
9,
guys.
10.
In theory, competition would mean that talent gets paid more.
And you guys can move up.
Yeah.
Competition would be better
Yes,
for
I
that
can,
station,
Andrew.
honestly. I think.
We're the highest rated sports talk station in the nation.
Yeah.
I mean, that's, New York, Philly, Boston, LA. I mean, higher than any market.
What do you guys get, like 15, 6,
Yeah,
20s?
it's just
Yeah.
ridiculous numbers.
That's
We got
great.
a 20 in men in March, which is just an unheard of number.
Wow. Yeah, somebody out there is looking at it and saying,
You would think.
all we got to do is take 7 of that.
Right.
We don't have to take half. We'd be happy with 7 of that.
Yep. Yeah, you're right.
Because when they started the fan in Dallas, they looked at the ticket was getting 12 and 13s, and they're like, we'll take a 4.
Right. Yeah, 4. I mean,
We'll not pay anybody.
In most markets, that's pretty good. It's kind of it's crazy.
We're going to talk in this block just about what you guys are talking about these days.
Okay.
The summer doldrums.
Cool.
7, 6, 5, 4, 3, 2.
Hi, everybody. I'm Mike Rogers, and welcome to another edition of Sportsline right here on News Channel 5 Plus. Open phone lines tonight for everyone, 615-737-7767. My guests tonight are Clay Travis and Jonathan Hutton from 104.5 The Zone. These guys were nice enough to come on and talk sports with me because there's so much going on right now this time of year.
There are no stories.
Who wants to talk Casey Anthony?
We talked a lot
we
of
can
Casey
do that.
Anthony. I can do that. I can do television shows. I can do, we talked Women's World Cup today. And we had, caller on caller crime.
That was the best. When there's
Sports
nothing going on, if you can get 2 listeners to call in and just go at it.
Like, we
with
can
each other.
probably get people riled up to call in tonight because they're just sitting around bored. Your time slot, there's probably a lot of drunk people.
That don't like network programming.
Well, and nobody's watching the home
Well,
run
it's
derby
the summer.
anymore.
It's old. Yeah, the home
Who
run
watches
derby. I mean,
that?
honestly, I think this is probably more entertaining than the home run derby.
So if you have a question for the panel tonight, 615-737-7767. Yeah, home run derby is just kind of boring now to me.
It's played
Me
out.
too.
We were talking about that today.
It's the same. It's not. I don't know. I don't know why I feel different about it now than what I did, because it is the same. But maybe it's because nobody wants to do it anymore. To me, and you're looking at some of these hitters that come in with 7 home runs at the midway point, and they're in the home run derby. It wasn't like that.
I always root for the kids to get hurt. That's what I'm too in the home run derby. You
The-
see all
the
those
little
kids
kids
running
in the
around.
outfield.
Yeah, it's kind of dangerous, right? I mean, major league players every year get hit by the ball and genuinely hurt. Why do they let kids run
It's
around?
not
I'm telling you,
easy.
it's a recipe for disaster.
Yeah.
Some kid is going to get hit. He's going to get a concussion. It's going to be a huge scandal. ESPN will cover it as if the president had just been assassinated. They'll
Yes.
follow the kid on his roller, out into the ambulance. I'm not kidding at all. They'll give you scrolling updates on this kid's status. I mean, it'll turn into the crime of the century before all is said and done. The player who hit the poor kid will have to apologize and give him that'll be on Live Sports Center. It's just a matter of time. I'm just telling you all that's where it's headed.
Who's the guy on ESPN that is almost forced to do the really sad stories like a year later?
It's Tom Rinaldi.
Yeah, and then it's like
Clay hates him.
It's
I
always
like
the,
him.
It's always
Clay
the
hates him.
my
piano
God.
keys.
It's
If you
yep.
have piano keys in a store, you would know this as a television guy. If you go to the piano keys, you're going maudlin, right? It's like, it was
Stefan Johnson.
yeah. It's always like like
The
twinkling keys.
Something
I
with
like
golf.
Rinaldi though. I think he's a good writer, and he draws you into whatever he's talking.